Hey everybody, welcome to Pillosphy, a production of the Counseling Center in Portsmouth, Ohio, one of the first and most widely affected areas of the opioid epidemic. I'm Senior Director at TCC, Max Lyles, joined here today with a couple friends, and we'll get to you guys in a second. Today we're going to talk about sort of some incarceration patterns in the United States, and then the need for reentry services, what those are, what those look like, and how they help people within that situation. But first, my two guests, Jami Munn, Zack Hamilton. What's up, guys?
How you doing?
Hello.
I'm ecstatic that you guys are here with me today. This is awesome. So first, Jami, give us a little rundown, what you do now, what you've been doing, sort of qualify yourself as the expert.
Like Max said, I'm Jami Munn. I have my bachelor's in psychology, and then I got my master's in education, counseling, and human development.
We got to shout out the universities too, because that's like a tradition of the Counseling Center. So bachelor's degree from
Marshall.
Go Herd, right? And master's degree from
Lindsey Wilson.
Okay. Lindsey Wilson is kind of a gang thing at the Counseling Center growing. OU Social Work's a big one, right? But then Lindsey Wilson is like the second gang. So
they have a really good counseling program. That's like what they're known for.
Yeah,
so.
Yeah. Evidently, yourself, Tara Fannin, and then all the way up to CEO Andy Albrecht, Lindsey Wilson. Yeah, man.
I didn't even know that.
You're in a gang.
I didn't even know it. That's a good gang to be a part of.
Yeah. So then, professionally, tell us about some of the work you've done.
So I'm dual licensed in mental health counseling. So that's my LPCCS. So licensed professional clinical counselor with a supervisor designation.
Man.
And then my LICDC, so licensed independent chemical dependency counselor.
Yeah.
And I've done a lot of work. I've done some children's counseling, just some community mental health counseling.
What was your first gig in the field? Where'd you start off at?
Prestera in Huntington. I was pretty much
I've
like
actually
an
heard
RSS.
of it. Okay, all right.
Because I lived in Huntington at the time. It's pretty much like what we call like a housing
like a support
person.
Staff. Okay.
Yeah.
And then from there, how'd that progress?
From there, I then was a case manager at a community mental health place.
Uh-huh.
And then I actually was at Star.
Yeah.
Where Zack's from.
Yeah. Not to steal your thunder or whatever. The CJC.
And that's really how I fell into chemical dependency counseling. Because especially when I was there, all the individuals that I had did have substance use diagnosis as well.
Yeah.
So we did a lot of CBT groups, things like that. And I really just fell in love with it at that time.
Absolutely.
Went back to community mental health for a little bit because I paid off my loans. And then wound up at the Counseling Center.
Yeah, man.
Yeah, and I'm the director there of Hughes ReEntry.
And then when you were at TCC, you went from, you sort of came in as a counselor, correct?
Yes.
Carrying your own caseload. And then how's that progressed to the position that you're in now?
So I was an AOD counselor, and then I was promoted to, and that was in town, and then I was promoted to coordinator at Hughes ReEntry and then director from there.
Yeah. So what's a day in the life of a director look like? What's some of the stuff you're focusing on as far as operating a program? No big deal. It's just 50 guys, you know what I mean? Just 50 lives in your hands, no big deal.
We got 53 guys.
Plus how many staff, no big deal.
Yeah. So we have our mental health staff, which has another supervisor, but they're on my team. Our case managers, our AOD counselors, CPST providers. So just really overseeing the day-to-day operations of the program, make sure everything's going as it's supposed to do or supposed to be.
And then coming in and doing, you know what I mean? Podcasts when you get asked, right?
Yeah.
Yes, philosophies, man. Cool. Well, thanks, dude. Zack, how about yourself, man?
Zack Hamilton, clinical director, Star Community Justice Center. I have a master's degree in social work from the University of Kentucky.
CATS.
Cats.
Yeah, man.
And
yes.
As well as a criminal justice background. I have a bachelor's in criminal justice from Ohio University. So
go Bobcats.
I'm a Bobcat.
Always
and a
go Bobcats. Yeah, always go Bobcats.
Yeah, and licensed social worker. Been in the field. Been in corrections for about 8 years.
Man,
yeah, been a minute.
Sure.
Actually worked at the Counseling Center.
Once upon a time.
Sat elbow to elbow with this guy in a little office.
Yeah, man. Wait, we're still there, man.
Busting out notes on
we're still
laptop.
there, elbow to elbow.
Day-to-day operations at Star. I oversee reentry, vocation, and as well as behavioral health.
Yeah.
We have 360 men and women.
Wow.
What else?
Man, that's a lot. What other sort of duties or responsibilities have you held like within the in the field or within the population before you got to where you're at now?
So I actually started out just direct care, case manager. Kind of progressed my way through that into more of a reentry scope.
Yeah.
Did a little bit of work there. Also did, aftercare outside of the facility, worked with probation departments and, community partners and things like that. And then I ended up being promoted to a manager, essentially over reentry. And then kind of just progressed my way into a director role.
Yeah.
Broadened my scope a little bit, with the focus on vocation.
Sure.
And behavioral health that kind of came with the license after
absolutely.
grad school. So,
and aspiring independently licensed. We're getting close.
Yeah. I'm just a handful of weeks away. So,
man, got to do that March. Dude.
Yeah.
I get it. Yeah. Anything else you want to add that we forgot or add in?
Maybe we might get to it.
Yeah, we'll get to a lot of stuff. Yeah, so we've got our agenda lined out. We got a lot of stuff we're going to talk about. And some of the first things we wanted to visit was just like some statistics and definitions, statistics about the U.S. and sort of our affinity for incarcerating people and the way that happens and what that looks like. But then also too, just some definitions about what reentry is. So I guess let's start there. It's like from y'all's perspective, give us a definition for somebody that's listening to us. We say that term like, I work with the reentry population. What's that mean to you guys? Whoever wants to start.
Start from a justice-involved perspective. I like to kind of define it as a transitioning process from an incarcerated individual to back out into the community and society. Best way I can describe it is I like to kind of use almost like a healthcare analogy.
Sure.
Some Johnny falls off a roof. He breaks 10 bones in his body. He goes to the hospital. Well, the goal while at the hospital is to continue to get better. Kind of like with rehabilitation, you commit a crime, you do your time, pay your debt. Well, the goal was to be better when you come out. So the hospital might operate on Johnny and, at that point, he's getting better. He's on the mend. He's going to spend, a couple more weeks at the hospital in observation. Well, they just don't kick Johnny out of the hospital and say, here's your ticket home. Head home and I hope you get better. Yeah.
Pats on back.
No, so they set you up with OT, PT, case management, medical equipment.
Yeah.
Reentry is kind of the same thing as far in the justice system to where, an incarcerated individual gets out. Once he gets out, he's going to need things like, OT, PT equivalent. So he's going to need a primary care provider. He's going to need, mental health treatment, substance abuse treatment, driver's license, things like that. So it's kind of like I said, that's the best way I can describe it.
Yeah, no, I like the analogy. What we leave out when you're trying to explain reentry to people, or what would you want somebody to know about the population you work with?
They face a lot of unique challenges that we have to help them overcome. And so just like pretty much everything he was saying, but it's also from like a rehab perspective. So where he's helping them integrate from incarceration, it's the same thing, which with like you complete treatment, now what?
Right.
Like that is a small bubble of time versus the rest of your life in recovery, hopefully.
Yeah. Yeah.
So just preparing them for that.
Yeah. And I think that's the main thing is like reentry, talking about like, I'm coming from this situation into a different situation. And that pathway really is from incarceration to the community, being a regular community member, somebody that makes multiple trips to Lowe's in a day. My joke is that's when you're an actual community member, is that when you're at Lowe's multiple times in the day.
Yes.
Right. So like, those definitions for reentry and kind of what we're talking about. So a couple statistics. The United States incarcerates more people than any other country on the face of the earth, right? Not only do we lead that statistic in total number, but we also lead that statistic in most individuals incarcerated per capita. So like talking about the need for reentry services, obviously, that's something that we're going to like run into just based on need. So at any given point in time in the United States of America, there's about 2 million people that are incarcerated. What are some other stats you'd like to share with people that are tuning in about that?
Well, I know from an incarcerated standpoint, I think it's 600,000 to 700,000 individuals are released from prisons.
So released
from prisons every year. 10,000 from jails.
Yeah.
95% of the people currently incarcerated are going to go home at some point. So, and that's kind of, you know, my qualm with it all is like, you know, as a community member, how can we help?
Right.
You know, my kids are going to be going to the same school. You know, this person's kids are, like, we're going to be at the same ball games. We're going to be shopping in the same grocery stores. How can I get involved? I'm trying to other stats.
Well, no, that's a huge number. You know, like 2 million people incarcerated at any given point in time is a huge number of people, right?
Yeah. And
then to think that the large majority of those folks are going to be coming home back into the community at some point in time is like demonstrates the need that without some sort of intervention, some sort of you know, system set up, that's like that revolving door thing. Because if there's 2 million and 700,000 are coming home, well, it means a lot of people are going back in, right? How do you think that's like created that sort of like revolving door, so to speak? Anything you think that contributes to that?
Just not being prepared. I mean, like anything that you're going to do, preparation is key. So you've been incarcerated and a lot of things have been on hold. You haven't had employment or education or been paying bills or budgeting or managing your money. So if we're not prepared for that, it can be very overwhelming.
No doubt. Yeah, that stuff's hard, right?
Yeah.
Another way to look at that 2 million people being incarcerated is 1 out of every 100 adults is going to be incarcerated in their lifetime. Like, so like think about that as like we have a ton of local school districts in like the Adams side of Lawrence, right? There's all those little pockets of schools. My graduating class had 100 people in it. So it's like just point blank, one of us is going to wind up incarcerated long term, dude. That's terrifying.
Yeah.
Right? Yeah. So then as far as the need is like obviously demonstrated, right? And through statistics and then also probably personal stories that folks are aware of or whatever. So you started to talk a little bit about some of those shortfalls, about the things we've got to prepare for. What are some of the things that you see that guys need to get ready for? Like what are they up against when they go out?
Well, they have, like I said, they've had a lack of employment, so they might have gaps on their resume. Yeah. And then they also have charges now that make it difficult to find employment. They just have the judgment of the community as a whole or employers when they see that.
Yeah, what role do you think like stigma and prejudice plays?
Oh, a huge role, I think.
Yeah. How so?
Because when people see that, like, even if it's not on the application, when they ask about, like, a gap in the resume and then they have to say, like, oh, he's in prison, I feel like people automatically get that, like, ooh, like the pause gets hit on it.
Yeah.
So,
yeah.
Then that's one of the things we do is help them navigate some of those interview questions, highlight some of the things they did. For example, if they're at STAR, the programs they were engaged in, or if they got their GED, or if they're with us, the program showing that they utilize their time.
Sure.
So that's one of the services we provide for them, the resume, the interviews, stuff like that.
Yeah. What about you? What role you think like stigma and prejudice plays with like guys and gals having a tough time getting integrated back into their old spots?
I mean, it's definitely, prevalent. I mean, there's no question about that. I don't know. I look at it like, where would we have Toy Story, without Tim Allen? Like the dude did 2 or 3 years, like in a state penitentiary.
Right.
Robert Downey Jr., we wouldn't have Iron Man. Like I guess the stigma, it's kind of like it's a two-way street.
Sure.
We're giving some people's opportunity, whereas, these guys coming back to our community, it's like what opportunity are business owners, and employers giving them?
Sure.
But yeah, like I said, I think it's very prevalent. It's very real.
And I think a lot of it too is it's a very polarizing topic. Like a lot of things where stigmas and stereotypes exist, is it's a really polarizing topic that has the ability to like shove people far right and far left in their ideologies, right? And a lot of it, I think, is really like getting back to the middle of, okay, sure, this person has a history of, you'd mentioned like paying a debt to society, right? But it's like once that debt's paid, it's like how long does that hold on?
Yeah.
Right. It's like there's the initial piece of where they have committed a crime and are involved in the legal system. But then after that, it's like there's residual effects, and I think that's one of the big things that they're up against is like the residual effect of an incarceration or a legal charge or whatever, right? So then talking about support and why that's important, tell us a little about like what you're referencing, what they do have, what they don't have.
Well, what we see from a justice involved standpoint is when men and women are released, and they go home, there's a big breakdown in family and community support. So working with probation departments, and watching these men and women come in, and it's like, a lot of them are PV, and then when you actually get to the root of why, it's like it always boils back down to a breakdown in support.
Sure. What is that? Let's pause there. Do the PV means?
PV. Sorry, PV
good,
means
man.
just a parole violation, probation violation.
Sure.
That could be anything from not paying child support to having a positive urine drug screen.
Yeah. So, and I think that's important too. Like within the reentry population, is it's not just like people are put into some sort of community control like probation or parole, and it's like, hey, good luck. There's rules and regulations that are supposed to be structured for people to follow, and that's supposed to be one version of support. Mm-hmm. But you talked about families. What's some of the like things that you see, Jami, in like trying to navigate some of those family situations that people are coming in from? Because that's like, I think, like another layer of the treatment thing, right? Like the individual person's in treatment, but their like use or incarceration has probably affected between like 6 and 8 people directly, right? Talk about that family piece a little bit.
So I think there's several different things that go into that. So we have a lot of parents that are getting incarcerated.
Sure.
And then so that they're away from their children for that time. So we have a lot of parenting classes that we do to try to help them with that. There's been trust that's been broken all around, whether it's your parents, your friends, your siblings, your children. So working with them on building those relationships back, those communication, the boundaries that are important. And then there's also people who come from an area where they don't have any support at all.
Right.
Their families are in active use. They have no support. They don't have loved ones there. So getting them connected to a recovery community, to other people who are willing to help them that maybe aren't blood related.
And that's like another, like a probably could be a whole other episode, but like talking about how a lot of the folks that we see in coming into treatment or coming out of an incarcerated situation into trying to reenter the community, generational poverty, generational drug addiction, generational issues with the legal system, right? I think that's like a huge thing, and something that is probably very specific to like Appalachia, right? And like the kind of the whole narrative that, Portsmouth, where we're recording at today, being like one of those like first and most heavily hit areas or whatever.